Hello, this is Brian Nelson in Houston, Texas. My main website, IamFightingCancer.com. I started out with trigeminal neuralgia 3 years ago. Painful disorder in the electrical charges to the head. Turned out it was a cancerous tumor in my jaw. It went from my jaw to my lung a year later, and now it's gone into my heart situation, the sac around my heart, the pericardium. So I'll explain a few things that happened recently for those of you who know me. On Wednesday, October 29th, I was given a thoracentesis by the cardiopulmonary center for an excessive fluid buildup in my left lung. The right lung also had fluid, but there was less there. On Thursday, October 30th, I was given an Echo Cardiogram as an outpatient. I discovered my shortness of breath. Discussed that with the technician, who immediately looked at my heart with the Echo Cardiogram machine, and it showed a significant buildup of fluid in the pericardium, preventing the heart from normally sending blood to the rest of the body as it should, and this also would cause my shortness of breath. Other staff immediately were called in to view the echocardiogram report live, and it was agreed that I need to be routed to the hospital via the ER admission. Then I think they did what's called a pericarditis, where they removed 450 milliliters of blood from the sac around my heart, and the gravity flow then continued for a day or so, where the fluid continued to fall out by gravity. Then they did a removal of liquid from my right lung under another thoracentesis. The lab results show that the heart fluid to be a metastatic non-small cell carcinoma. In other words, this is malignant material in my lung. Then on September 4th, the doctor came to my room at the hospital, did a portable echocardiogram, and checked out that, said that my lung did not have enough fluid in it to justify putting in a Denver catheter, which is a spigot that would go on my lungs so I could drain it daily. Then I finally got released from the hospital when they didn't have anything else to do with me, but they never gave me any exit instructions, didn't ask me anything. So I'm looking for lay answers instead of crying wolf. I did cry wolf with 4 phone calls to my oncologist via his PA, and then never got the calls returned, saying I was out of breath, but that didn't seem to make much difference. So my question now is, what do I do? I was given no instructions. What can I do to expect from my heart? What various symptoms might come up, and what should I do about them? What problems can I expect from my lungs? And then what do I do about those? And why am I waiting 15 days for an appointment to see the oncologist when I've got a metastatic non-small cell carcinoma in my pericardium? So do these things just normally just get smaller, or do they not want to treat it while it's there? But nobody told me anything. You just have to ask questions, and I still can't get answers. I get out of breath. Should that improve? How long should I continue to cough? Don't know how long. How much exercise should I do? Can I cut the grass, shovel sand, use a sledgehammer, or pound nails? Is that good or bad for me? When I went in the hospital, I was 167 pounds. When I came out, I was 148 pounds in 6 days. So they pumped off a lot of fluid. So if you have any ideas, make your comments here, what you expect from your doctors, and then we'll consider any thoughts that you have so I can proceed to get my cancer taken care of. Adios, and look for my website in the upper right-hand corner, IamFightingCancer.com, and see some pictures of my latest hospital stay. Bye-bye.